Hello, my name is Abraham Salinas, and I am a research faculty for the College of Public Health at the University of South Florida, Harrell Center for the Study of Family Violence. This video series project is a collaboration with the Hillsborough County Domestic Violence Task Force.
Surviving domestic abuse is a traumatic experience. Our intention with these videos is to improve services for all survivors. Our vision for this project is to create a repository of videos that can serve as a resource for those who work with domestic violence providers, including those in the judicial system, law enforcement, social services, domestic violence shelters, child welfare system, and other community-based providers.
The Spring is one of 42 certified domestic violence centers in the state of Florida that provides comprehensive services to survivors of domestic violence. One of the most common services that people think of when they think of the Spring or the certified center is the emergency shelter, which is one of our largest programs. We have a 128-bed emergency shelter for survivors and their children who feel as though they're in danger because of domestic violence and need a safe place to stay. For survivors who are residing in our emergency shelter, we also have a lot of services available beyond shelter. Everybody is assigned an advocate who provides case management services to them. All of the children that are in shelter also are assigned an advocate who can address their very unique needs and get them linked with services in the community. We have a Hillsborough County school, kindergarten through 5th grade. So if it's not safe for a child to stay at their school of origin, they can attend classes right on site. We have a health and wellness champion. We know that being a survivor of domestic violence can have pretty negative impacts on a survivor's physical and mental health. So our health and wellness champion links her with resources in the community to address her health and wellness needs. We created a pet program, and we have partners in the community that are wonderful and will board animals off-site as long as the family is residing in our emergency shelter. We also serve survivors who are still in the relationship and are still trying to make that decision if they want to leave or are able, or if it's even safe at that time. We try to make sure that survivors know, since as they're leaving is the most dangerous time and right after they've left, that we want to make sure that before they leave, if they have the opportunity, to develop an individualized safety plan with an advocate. So we do a lot of that at our outreach office, both in Tampa and Plant City. We have 7 full-time attorneys that are incredibly busy, and all they do is assist survivors with filing for injunctions for protection. If she's not sure if that's what she wants to do, she can meet with one of our attorneys and talk about the situation and see if it makes sense for her. They also will represent them at the injunction hearing. We also have a prevention program. We have 2 advocates who spend a lot of time in our local middle schools and high schools providing programming around teen dating violence, healthy relationships, conflict resolution, and they also coordinate a yearly teen summit, which has been really neat to see evolve over the past few years. The majority of the survivors that we serve, particularly in our shelter, are women and children. About 50% of the people served in our shelter each year are children, and we have a whole lot of young children that are in our shelter. But we do serve men, and we have a number of men that come through the shelter each year. We also are seeing a lot more survivors from same-sex relationships reach out for services, which is good. We've known that there's been violence in same-sex relationships for years, but we're seeing more survivors reach out. Our shelter stay is based on 6 weeks, but 6 weeks is not a very long time for somebody who might need to find employment and safe and stable housing. Also, we have to keep in mind that survivors come to us after a crisis, so it's important to give them time to heal as well. I believe that safety planning is one of the most critical services that we offer here at the Spring. As a survivor is in the process of leaving, and right after she's left, can be incredibly dangerous. So we always encourage survivors, as they start to even think about leaving, that they reach out to an advocate to develop a safety plan. So one of the things we want survivors in the community to remember is they do not have to be referred from another agency. They can just pick up the phone and call our 24-hour hotline. 247-SAFE, it's a very easy number to remember, and they can call anonymously and just have a conversation with an advocate over the phone.